Silence my phone.
Hi, this is Tony Conover with Natural Awakenings Low Country in Charleston, South Carolina. And today I'm very happy to have Dr. Penni Vachon with me from Low Country Wellness Center to talk a little bit about what's going on with her practice during this pandemic. And so without further ado, this is Dr. Penni Vachon. And Penni, if you would just tell our listeners a little bit about yourself and your practice.
Sure. So I'm Dr. Penni Vachon. I am an adult nurse practitioner. I own the Low Country Wellness Center, which is a integrative and holistic primary care practice in West Ashley. What really sets us apart, though, is my practice is a direct primary care, which means that my members just pay a flat monthly fee. And for that, they get unlimited office visits, 24/7 access to me. They get all of their services at wholesale pricing. They get an annual physical with some labs. And before we had a COVID-19 pandemic, my patients all had access to me via telehealth. That was all included in their membership. So this has changed some things, but it hasn't changed a heck of a lot for us.
Right. Well, with full disclosure, I am a patient of Dr. Penni's, and she is the most thorough practitioner I've ever been to, and I feel very lucky to have found her and feel like I'm in excellent hands with her care. So so you were already doing that, and when she says she's accessible 24/7, she truly is. So I've seen it with myself and others who I know that go to her. She's always there for us. So thank you for that, especially during this crazy time.
Yeah.
So I guess the main thing I want to talk about today is any tips you have for people during this pandemic and staying healthy.
Yeah, I think, especially right now, I think there's this misconception that social distancing means social isolation, and it doesn't have to. We're still connecting, we're socially connecting, we're just doing it electronically. So, what I'm seeing is a big uptake in anxiety and depression type symptoms because everybody's alone and fearful, and rightfully so to a certain extent, right? There's a certain level of fear that comes with a global pandemic. So the things that I recommend to kind of keep us healthy here, but healthy physically as well, is stick to the same routines that you had. Get up at the same time of the day, shower, dress yourself, get everything ready like you were living your regular 9-to-5 life. Eat healthy, really hydrate well. And then, get out. It's beautiful. It's Charleston. Sit at the back deck and absorb some vitamin D. We know that COVID-19 and the coronavirus family in general does not survive well with an adequate level of vitamin D. And Tony, that, my adequate level of vitamin D is very different than most practitioners' vitamin D levels. So, I want you guys taking a vitamin D supplement, and I want you guys taking vitamin C. But more importantly, I want you to be able to reach out should you have questions. Make sure that you're getting the right information and you're not absorbing all of your information from social media or from the news, which is unfortunately all doom and gloom. And, there are good things happening in the world. And I think as a society, we tend to focus so heavily on the negative that we kind of forget that there's some good going on. And that plays a role in our physical and emotional health as well. So, I think the pearls of wisdom, if you will, is hydrate, eat the rainbow, right? That's kind of always the healthy way to eat. And get your vitamin D, get your vitamin C, and wash your hands, right? That's simple. Wash your hands.
Right. Excellent. Well, thank you. So it seems like the symptoms of COVID-19 vary a lot from person to person. I've heard of people testing positive who never had symptoms from some of the cruise ships to all kinds of symptoms, from mild to like our Representative Cunningham with loss of smell and taste to gastrointestinal type things to, of course, the ones we know about, fever and cough. So I was wondering if you could talk a little bit about people who are having various symptoms. When do they need to be concerned? basically?
Yeah. So, well, first let's address the symptomology. So what we know now, going on several months of knowing about this particular strain of coronavirus, is that there are several mutations that already exist for it. The data that I saw last night from the World Health Organization shows 9 different strains of Corona 19, which accounts for why we have so many different symptoms with it. So we don't know which strain, we'll call them, A to K, right? Because we don't know if you have the A strain, the D strain, or the K strain. We don't know. Um, but we know that at the end of the day, they're all a coronavirus. And so, the best advice is don't bog down our ERs. Our ERs need to be saved for the people who are in acute respiratory distress. Anything shy of that should be and can be treated at home. I'm fielding calls and I'm seeing patients that urgently need to be seen for, dehydration from the GI side effects. I can treat that in the office. That doesn't need to take up a hospital bed. We can treat the mild to even maybe the moderate respiratory symptoms at home with proper interventions and stuff, and really saving those really acute patients that just can't make it at home to be treated in the hospitals and go to the ERs. So it's interesting that we've seen this shifting, if you will, in how the symptoms come on. Originally when it was just over in China, it was strictly respiratory. And like I say, we know now that over the last probably 5 or 6 months, it's been mutating a little bit. And so, the hard thing for us here in Charleston is it's Charleston pollen season. So at this time of the year, 80+% of our community has upper respiratory symptoms. We've got the coughs and the sneezes and the drippy nose and the postnasal drip, and I'm fielding calls and text messages and emails constantly, and my message is the same regardless. If you have any suspicion or any question in your mind that you could possibly have COVID-19, stay home. Do not leave your house for 2 weeks. Now, if you've got the big fever, which is one of the big cardinal symptoms, then the rules are a little bit different. It's not just simply stay home. It's you have to be fever free for 24 hours and your clock starts then. And so, I think we're going to see a continuing of the trend coming up, because I don't think enough people take it seriously. But I also think there's such a variety of symptoms that most people just don't know. And, the general rule I think needs to be across the country: if you have any symptoms that are different than your baseline symptoms, let's say for me, I'm an allergy person. So, every January to May, I know that I have postnasal drip and I have itchy, watery eyes. So if those are my only symptoms, then it's probably the pollen. But if all of a sudden I have this dry cough with it and a little bit of a fever, then I'm going to be suspicious that it's something else going on, and I'm going to hunker in place. And that's what we need. We need everybody to stay home. There are people that have to go out, but the majority of people don't. And I went to the office yesterday to treat a patient, and I couldn't believe how many people were out and about on a Sunday in the middle of a pandemic. I was furious with our community.
Right, right. Yeah, it's scary. So have you seen or does the literature say anything about symptoms that come and go, or do they continually get worse?
Yeah, so not only do the symptoms have the potential to come and go, but we are seeing reinfections happening. So we're
Wow.
seeing people that maybe and probably had COVID-19 back in November and December, that had that respiratory stuff that we all thought was just sinusitis, are now coming back around and getting reinfected. And so you might be somebody that had really mild or no symptoms. Your body initially cleared, let's call it strain A, but now strain B is making a run. And so you don't have immunity to strain B, you only have immunity to strain A. So
Mhm.
you might get strain B. And that's the hard thing. That's why this shelter in place is so important for everybody. We have got to stay home and stop spreading it without knowing that we're spreading it.
So you think a general rule of thumb is if you're having any symptoms that are different from you this time of year, stay home. When in doubt,
That's it.
stay home.
Exactly. Correct.
Okay,
Yeah.
cool. I'm hearing that the real switch will be when there's testing that's available, even like at home testing, and then we'll really be able
Right.
to tell, but
Yeah.
we're not
In
there.
South Carolina, it's really hard because DHEC is running about 2,000 tests behind.
Mm,
So we have patients that tested in early to mid March. I know of a patient of mine in particular who tested March 12th. Today's March 30th. She still doesn't have her results.
wow.
So I told her, you've got to stay home until we're clear because I don't want to put the population at risk with you going out and we didn't know. So, one of the big things I've been telling everybody is, irregardless of if you have the test or not, if we all just treat ourselves like we're either the carrier or we have it actively and we shelter in place for that, then we're doing so much good for the greater community. It doesn't matter if it's positive or not. I have friends that have graciously flown to New York City and are nurse practitioners in the ERs up there. And she said they're only testing patients who need ventilators. There's just not enough to go around. And they're just assuming that every person has it. And so they're only testing the ones that need to be intubated and need to be in the ICUs, and really only for their, I guess, personal knowledge, if you will, because they're not changing how they're treating the patients. And I think, as a general society, we want the test, we want the quick answer. But if we all just assume that you're a carrier, then we protect ourselves from each other for that, it doesn't really matter unless you're that critical patient who needs to be intubated and ventilated, then absolutely we need to know what we're facing.
Right. Well, thank you so much, Dr. Penny. This has been very helpful to me, and I'm sure to everyone who will watch this. So, any parting words?
Yeah, I think during this time, this is our time to get some good self-care practices down. It's such a stressful time. We're all so consumed with what's going on with the news and the media and what are the numbers, and that stress plays such a role in our immunity. So stop, give yourself a time limit. I'm only going to go on social media X amount of time, and I'm only going to go to these particular pages. Um, Practice meditation every day, exercise every day, get some fresh air every day. And like I said before, stay hydrated, eat the rainbow, do all the right self-care things, and be part of a community. If you can't be in a community in person, do things like this. I've been hosting social hours on social media on Zoom for anybody that just wants to jump on and feel like they're part of a community. Most of them don't even know each other, and we just get on and talk about life in general. And it's just a way to decompress from all the stress that's going on in our current society.
Great advice. And yeah, I know you come from a functional perspective that mind, body, everything's connected, right? And so
Yes,
those tips for
very
staying
much so.
healthy, meditation, stress reduction, self-care, I think more than ever, we're going to learn how important that is.
Exactly. Yeah.
So in terms of your social meetings, that's awesome. When will you be having your next ones, and how can people find out about that?
Yeah, so we're posting them on the Facebook page for the practice, which is Low Country Wellness Center. It'll be on Facebook and Instagram. We did one this weekend. I've tentatively got one that we'll probably schedule tomorrow night. I'm just trying to reschedule another meeting that I have. If not tomorrow night, then definitely Wednesday night will be our next one. And we'll just be online from 7 until whenever everybody's done.
Okay, awesome. Well, thank you so much. Thank you so much for taking care
Yeah,
of your patients
absolutely.
so well, and
Thank
bringing
you.
the community closer together during this time. And I'm sure we'll stay in touch. Thanks so
Absolutely.
much.
Stay safe.
You too. Take care.
Thanks.
Bye bye.